Every year, millions of people with type 2 diabetes develop a stiff, aching spine, and their doctors never fully explain why. It's not just aging. Diabetes may be silently hardening the ligaments around your spine, and today, we're showing you the real science. In the next few minutes, you'll learn exactly why this happens, and the real medical steps that can help reverse it. Welcome back to Diabetes Reversal. Today we're breaking down a hidden diabetes complication that almost nobody talks about: your spine. A chronic stiff spine means reduced flexibility, aching muscles, and difficulty bending that lasts for months, not just days. Research shows people with type 2 diabetes face a significantly higher risk of spinal stiffness and disc degeneration.
The culprit is high blood sugar creating advanced glycation end products, or AGs, a process first mapped by researcher Dr. Anthony Cerami. These AGs bind to collagen in spinal discs and ligaments, turning once flexible tissue stiff, brittle, and far less elastic.
Over time, this can lead to a condition called Diffuse Idiopathic Skeletal Hyperostosis, or DISH, where soft ligaments harden into bone. Later, Dr. Donald Resnick defined the diagnostic criteria still used today: bone flowing continuously across at least 4 spinal levels. A study of over 1,500 patients found this condition in 17% of them, with diabetes as a major risk factor. Scientists believe elevated insulin levels push stem cells to become bone-forming cells instead of soft, flexible connective tissue. This bony buildup most often targets the thoracic spine, the mid-back region, causing that signature stiffness and reduced motion. Common symptoms include morning stiffness, a reduced range of motion, and a dull ache that worsens after long periods of sitting. Because a fused spine loses flexibility, even a minor fall can cause a serious fracture that a healthy spine would easily absorb. A multi-center study of 177 spinal fracture patients found diabetes worsened surgical outcomes and slowed recovery time. In the neck, bone spurs can press on the esophagus, making swallowing, speaking, or even breathing difficult for some patients. This pressure can also disrupt sleep, lowering oxygen levels overnight and placing added strain on the heart. Doctors diagnose this condition using X-rays, CT scans, or MRI, since it rarely causes symptoms until it's already advanced. The good news is this process can be slowed, and in some cases improved, starting with one critical factor: blood sugar control.
Keeping HbA1c near a normal range reduces new AG formation, helping slow the stiffening process in spinal ligaments over time.
Studies show consistent glucose control over months to years measurably slows collagen stiffening, though existing changes may partly remain. Physical therapy is essential.
Guided stretching and mobility exercises help maintain range of motion and reduce day-to-day stiffness. Simple daily movements, like cat-cow stretches and gentle spinal rotations, can help preserve flexibility in early-stage stiffness.
For pain and inflammation, doctors may prescribe anti-inflammatory medication, always tailored carefully to a patient's full health profile. Reducing excess weight lowers mechanical stress on the spine, while also helping improve the body's insulin sensitivity. In severe cases with nerve compression or fractures, surgery may be needed to stabilize the spine and relieve pressure. Recent laboratory research using animal models is helping scientists understand how spinal calcification triggers pain and nerve changes. Doctors now recommend metabolic and spinal screening for prediabetic patients, catching early hardening long before symptoms appear. Your results show early signs we can address. That's good to know. A balanced diet low in processed sugar, combined with regular movement, remains the most powerful tool against this condition. If you experience back stiffness and manage diabetes, talk to your doctor about a spinal screening today. Thanks for watching Diabetes 2 Reversals. Subscribe and hit the bell so you never miss the science that could change your life.